Welcome to Self-Healing Channel. I'd like to invite everyone who's interested in self-healing. Mental health is important. This is our virtual counseling session 3 on how to manage depression. Today, we're going to talk about the ins and outs of cognitive techniques to manage depression. So stay tuned. Hello, my name is Hong Jeong. I'm a licensed clinical social worker and psychotherapist. First, I'd like to review what we talked about. So if this is your first video, I highly encourage you to watch the previous session so that you can catch up with the previous materials. And first, I'd like to check in with you. How would you describe your mood lately? And I'll give you time here. Do you remember structure? I'm going to ask you a set of questions and you take your time to think about the answers. It'll be nice to have pen and paper handy so that you can write it down, or you can say it out loud, or you can just think about it in your head. So how's your mood lately? Alright, with that in mind, do you remember the inventory for depression? It's called PHQ-9, Patient Health Questionnaire 9. In the description box, there's a link to PHQ-9. So why don't we take time to fill it out so that you can compare your score with your previous score. So I'll give you time here and take your time to fill it out, looking at past 2 weeks or past week. Is your score higher or lower than your previous score? If your score is lower, that means you're making progress, you're becoming less symptomatic. If your score is higher, that means we want to work on this. We want to monitor your symptom so that you know which symptoms you want to work on. Alright, let's review on behavior techniques. Can you tell me at least 3 effective behaviors that you engage for your mental health? To evaluate the effectiveness of those behaviors, let's notice any change on your physical, emotional, and cognitive state. Before and after using behavior techniques, what emotional and physical change did you notice? For instance, after a 10-minute walk, I noticed that less tension around my shoulders. After having a conversation with my brother about my issues, I noticed that my depression has decreased. I was able to concentrate better. So I'll give you time here to kind of think about any physical, emotional change that you notice. Again, you can write it down, you can think about it, or you can say out loud. And let's take a look at the cognitive change after using behavior techniques. After engaging in effective behaviors, what happened to the pace of your thinking process? Did your thinking process become faster, or still the same kind of neutral, or slower? What happened to the order of your thoughts? Did your thoughts become organized or disorganized? And lastly, the timeline of your thoughts. After engaging in effective behaviors, did you think about future? Did you think about the present moment? Did you think about the past? We want to connect dots between our physical, emotional, cognitive state. For instance, when your thoughts are organized, do you feel calm or do you feel stress? When your body's, let's say your shoulders tensed up, is your thinking process become faster or neutral or slower? Let's monitor this interconnection between your physical, emotional, cognitive state, because they work together and they are sometimes impacting each other. So let's monitor this together. Today, we're going to talk about cognitive techniques. In each session, I like to give you tools that you can work on between now and next session. And in our last session, we talked about this theory that our emotions are connected to our behaviors and our thoughts. Cognitive behavior therapy emphasizes the point that awareness around our behaviors and our thoughts is key in recovery, this healing process. Our behaviors and our thoughts are the good indicators of healthy or unhealthy psyche. I mentioned that behavior techniques are the quickest and the most effective tool to regulate our mental health. However, in the long run, cognitive techniques can be more effective because our thoughts create choices. Our choices create actions. Actions create characters. The characters create your destiny. Again, healing process is very individual experience. So one can say, I prefer behavior techniques, and the other person can say, I prefer cognitive technique. So I want you to kind of test the water to see which one is more effective. And you master that, whatever tool that you want to use for your mental health. Alright, let's cut to the chase. The first question I'd like to ask you, do you worry? Do you have a lot of thoughts on your mind? Granted, we all worry. However, excessive worrying or rumination is a clinical term defined by having consistently uncontrollable and irrational worrisome thoughts. Have you ever worried about something for 5 hours straight? I bet you felt physically and emotionally drained. So my question is, do your consistent worry create distressing emotions such as anxiety and depression? If your answer is yes, you're likely to experience excessive worrying or rumination. To help you understand better, functional worry help us analyze the problem, help us identify possible solutions, whereas excessive worrying or rumination is creating or fixating on more problems. So it's not problem solving, it's just creating more thoughts about the problems over and over. One of the symptoms of depression is feelings of worthlessness and hopelessness. How are your worries connected to your depression? So can you tell me at least 3 worrisome thoughts associated with feelings of hopelessness and worthlessness? And I'll give you time here. The more hopeless and worthless thoughts that you have, the more depression you will experience. So we want to monitor these thoughts related to this sense of hopelessness and worthlessness. Before we go into cognitive techniques, I'd like to hear from you. How do you manage your thoughts? How do you manage your worries? What technique do you use to stop thinking about the problems? So can you tell me about that? My guess is that the more you're trying to push away or stop your worries, more attention that you give to your worries. I see our thought as 5 senses. Can you stop seeing? Can you stop smelling? Can you stop tasting? Unless I have some sort of impairments, my senses are always at work. With that being said, let's get into ins and outs of cognitive techniques. The first tool that I like to present to you is called cognitive diffusion, adopted by ACT, Acceptance and Commitment Therapy. The premise behind cognitive diffusion is that instead of being fused with our thoughts, diffusing yourself from your thoughts can help us regulate ourselves. When being fused with our mind or our thoughts, we take our mind or our thoughts too seriously. In other words, we see our thoughts as factual thing, as a fact. For instance, if my mind says I'm gonna have a bad day, that means I'm gonna believe that all the ideas supporting a bad day, 100%. Here's a little shift that I like to make. When my mind says you're gonna have a bad day, can I acknowledge it and say, you know what, I can try to have a good day? Now that's the question, right? That's the dialogue that you want to have, with yourself. I don't trust my mind 100%. That doesn't mean I don't trust myself. Whatever my mind's saying, I just take it as information. My mind can be very black and white. My mind can exaggerate my reality. So I don't trust my mind 100%. Do you trust your mind? So the first tool is to observe your thoughts by labeling your thoughts. Instead of creating more narratives or stories or ideas supporting one particular thought, I'm gonna see that thought as insecure thought. Here's the catch. We're here to come up with a one word to describe the whole thinking process, the whole narrative. Going back to the example of my thought of having a bad day, I'm gonna label that thought as insecure thought. To observe that thought from a distance more and more, I like to repeat to myself out loud, I'm having an insecure thought. I'm having an insecure thought. I'm having an insecure thought. The more I repeat to myself, the more distance I'm creating between myself and my mind. With the distance that I have with my thought, it helps me to look at my thought more objectively and rationally. With labeling your thoughts, you can be creative in this process. You can label your thoughts as hopeless thought, worthless thought, insecure thought, emotional thought, angry thought, positive thought, motivational thought, inspirational thought, hopeful thought, you name it. So use your imagination in this process. Another cognitive diffusion technique is to treat your mind as a separate person. When your mind becomes chaotic and irrational, you can say, I'm noticing that my mind is worried about something. I'm noticing that my mind is concerned about something. To be silly, I can say, I like to name my mind. So I can say, I'm noticing that James is concerned about this. James is having a lot of irrational thoughts today. The main concept of cognitive diffusion is noticing your thoughts from a distance. With the distance between yourself and your mind, you can buy time to look at your thoughts and process your thoughts more objectively and rationally. Today we cover cognitive diffusion skills. I highly encourage you to use these skills in a neutral setting or neutral mood first, because it is imperative to practice enough so that you can build a tolerance and mastery over the skills. I also encourage you to use your cognitive skills along with your behavior skills, because we want to be creative with our healing process. Again, healing process is not a cookie cutter. It is individual based experience. So you can kind of mix them up together. You can go for a walk and then label your thoughts, or you can listen to music while you're labeling your thoughts. So let's be creative. Let's be patient with ourselves at the same time. Make sure you create a time and place to work on your healing and observe any change that you notice physically, emotionally, and cognitively. And I like to hear your progress. So don't hesitate to leave a comment about the progress that you're making due to using cognitive techniques and behavior techniques. Take care of yourself and do your healing every day. I will see you in our next session.